Good evening. My name is Irene Morales, and this is a role-playing exercise for class N5382 Nursing and Healthcare Policy. Today I am interviewing Mr. Hernandez.
Hello, I'm Irene Morales.
Hello.
It's nice to meet you.
And nice to meet you too. He is a hospital board member for my current place of employment. And so today I just want to have a minute of your time to discuss a concern of safe nurse to patient ratios. Nurse to patient ratios are lacking in every state with the exception of California, and it's of great concern for both patients and nurses. Research has demonstrated a strong correlation between high nurse to patient ratios, high nurse turnover rates, and unacceptable patient outcomes. Positive adjustments made to nurse to patient ratios have been scientifically proven to improve patient mortality rates as well as overall patient outcomes, not to mention a safe practice environment for nurses. Patients and nurses alike are regularly placed in risky situations without the implementation of safe established nurse to patient ratios. And it's been my experience that safe nurse staffing is not always a priority when it comes to hospital administrators, but administrators tend to cut corners on staffing in order to stay within budget and expect direct care nurses to assume responsibility for too many patients in order to effectively achieve quality care and quality outcomes for our patients. So this isn't safe for the nurse or for the patient. Proponents of established ratios say that forcing hospitals to meet minimum staff requirements is the only way to ensure patient safety, reduce patient deaths, recruit new nurses, and stop the nurses that are already on the job from burning out and leaving the profession. But opponents say that the ratios aren't flexible enough to allow hospitals to operate safely and efficiently, and that certain hospital units could be forced to close if the ratios couldn't be met. So, taking that into consideration, I have a couple of alternatives that could possibly help mitigate these issues with nurse staffing. One of those is for hospitals to be obligated to post the ratio of healthcare workers, and this public report would give customers the information they need to choose a hospital, and it would also apply pressure on hospitals to hire and staff adequately. A second alternative would be to ensure that bedside RNs have input in staffing decisions, and that the level of intensity of care also be reflected in the staffing system. So I thank you so much for your time. I just wanted to give you a little piece of nursing practice concerns. Thank you, Mr. Hernandez.
Thank you, Ms. Morales. I will look into it.
Thank you.